Thank you, Chairman Cox, and thank you to everyone. You know, from the beginning of our coronavirus response, the aim was to flatten the curve in an effort to preserve the integrity of our healthcare system. There was a very real concern at the outset that we could overwhelm our healthcare system because we had seen that happen in multiple other places. Our initial stay-at-home orders did that. We were successful in flattening the curve, but it also bought us time to build up our supply of personal protective equipment, our ventilators, to increase our testing capacity, our contact tracers, and to prepare for a point where we could reopen. At the outset of reopening, we acknowledged that with increased presence and increased operations with businesses and the opportunity for leisure activities, there would be increased spread. And we didn't think that we could stop all spread, but what we wanted to avoid was significant spread. And that's why we put in place the triggers that we outlined some time back. The triggers are early warning indicators that we are seeing increased or significant spread. As you are all aware, we have now hit triggers related to outbreaks. We've seen significant increases in the number of cases. We've seen jumps in the percentage of positives, and we've seen increases in our hospitalizations. The reality is this forces us to take action now in dialing back some of the things that we had reopened. Even with the actions that we are taking today and the actions that are likely to come throughout the course of this week, we expect that we will see continued increases in cases. And I think it is important to understand that there is a significant delay between when community spread happens and when it is reflected in the numbers that we see. And to those out there who will say that we are overreacting, I would just point to them the reality that the indicators and numbers we have are significantly behind what has happened. If you have community spread and transmission and you come in contact with someone who's positive, you will not likely know that you may have been exposed for the incubation period of 5 to 7 days, and then you might begin to see mild symptoms. Then you decide to get tested, and perhaps it takes a few days to get tested, and then it takes a few more days to get results. We could now be several weeks out from that initial exposure before that individual even knows they're positive. Then we begin the contact tracing process with close contact with that individual. And so there are significant delays, which is why it is imperative that you have to take action early. At the outset of our coronavirus response, we took significant action early, and we were a model for the region. And so now we're in a position where we have to begin to take action now in an effort and hope that we can slow the spread. Again, we can't stop it, but we want to slow it. And we want to, most importantly, slow it to a point where we can avoid full lockdowns or going back to where we were in March. While that is certainly a possibility, that would be the worst case outcome for our region. It's better if we can take incremental steps to dial things back, increase public awareness, and slow the spread to a manageable level that allows us to preserve the integrity of our healthcare system. And so starting this week, as Supervisor Cox mentioned, going into effect midnight tomorrow, we will be closing all bars, wineries, and breweries in San Diego County that do not have a license to serve food. Over the weekend, the state of California took a similar action for a number of counties, including pretty much all of our neighboring counties to us. And the reason that the state of California took this step for counties, not San Diego, but for other counties, is because bars are purely social settings where different people and groups often mix. It's a simple reality that alcohol consumption impairs judgment and may lead to less compliance with physical distancing guidelines. People often spend more time in a bar than other establishments like a restaurant for eating. Loud bars and loud settings require loud conversations and yelling, which spreads droplet more efficiently and effectively than you would see in other settings. And then people who do not know each other often congregate in bars, making it difficult to engage in thorough contact tracing about who may have been exposed. While San Diego County was not included in the actions taken by the state, we believe it is appropriate and we believe it is wise for us to take this action now, given the increases we've seen in cases, in percentage of positive cases, in outbreaks, and the increase in hospitalization. We don't want to wait to be forced to take an action when we know that it is the wise and responsible thing for us to do now. So beginning Wednesday morning, July 1st, the following changes will go into effect. First, bars, breweries, and wineries that do not serve food must close. Second, we are reinstating the order that beer, wine, and alcohol can only be consumed at an establishment while you are simultaneously eating a meal. This means you can't go to a restaurant that serves beer, alcohol, or wine and just sit at a table and drink. Any drinks you consume must be a part of your meal. Enjoy your meal, have a few drinks while you enjoy your meal, and then when you're done, exit the establishment and go on your way. Third, if you do go to a bar, brewery, or winery that does serve food, there is no standing. This is consistent with our public health order, but we want to reemphasize it so that all of the restaurants out there that serve both food and alcohol know that it is only allowable to consume food and alcohol when seated at a table. This is a part of the order, but we want to reemphasize it. In addition to this action, we fully expect in the coming days we will be instituting additional changes to our public health order and additional dialing back and guidance that are a part of our effort to slow the spread of COVID-19. As was previously mentioned, we will not be considering any new reopenings on new guidance that comes from the state of California, at least for the duration of July. 3, we'll be speaking to hospital CEOs today and looking at what they might need and what steps they might wish to see taken, both as it relates to our hospital system and healthcare system, but also the broader community. 4, we will be working on efforts to increase enforcement, both what we can do internally through our public health agencies and with working with law enforcement. And 5, we really want to focus around July 4th weekend. This is obviously a large holiday. It is common for folks to gather, and we are strongly encouraging San Diegans to please be responsible and avoid gatherings, avoid indoor gatherings. We're reminded that there are no mass gatherings allowed at private homes and residences. We have seen a number of outbreaks tied to individuals having parties at their home, and that is not only against the public health order, but it will set us back as a region. The most patriotic thing we can do on the July 4th weekend is adhere to the public health orders and work to save lives. And that is what we are hopeful that we will do. And that last point really gets to the essence of what we're saying, is that we cannot do this alone. No public health order and no increase in enforcement alone will slow and stop the spread. We really need each and every San Diegan to buy into why this is important. It's important to preserve life. It's important to preserve our ability to continue reopening. And so we continue to ask everyone to please utilize a face covering anytime you're within 6 feet of a non-household member. Please avoid large indoor crowds, and please take seriously the work of our contact tracers. Last Thursday, I was notified that I had close contact with an individual who had tested positive for COVID-19. While I have no symptoms and feel great and have tested negative, I am following the public health guidance around quarantine. 14-day quarantine for those who have been in close contact with a positive. This is a cornerstone and hallmark of effective public health, but it is also essential to our ability to slow the spread moving forward. And so we ask the public, if you receive a phone call from a contact tracer, please engage with them. Please be honest with them. Please be candid with them. If you get a call that says you've been exposed to someone who's a positive, please adhere to the 14-day quarantine. We're going to have to all get used to the new normal, where we may have friends or family members, coworkers or employees who have to go into a quarantine. It doesn't mean you can't work. On Friday, I participated in a California Resources Board meeting, a workforce partnership meeting, numerous meetings around coronavirus. Here today, I'm joining our press conference. We've been in meetings all day surrounding the actions we're taking now. But it is important that we all do our part to slow the spread. And so we are asking for the public's help and cooperation. We don't want to dial things back. We definitely do not want to go back to a full shutdown, but we have to manage and contain the spread here. And so we're asking for the public's continued help. With that, let's jump into our charts for today. We will begin with the first chart, which is our T3 chart around testing, tracing, and treatment. So what you'll see here today is continued significant progress around testing, and I want to commend everyone in our public health department, Health and Human Services, for the increases we've seen. Today we're reporting 6,908 tests. Our rolling 7-day average is 7,782. We are well beyond our initial goal of 5,200 tests per day. We have worked to expand testing. The Tubman Chavez Center is available for non-appointment testing. You can show up and wait in line and get tested. We are seeing an increase in demand for testing as we see an increase in cases And we encourage folks to go to 211sandiego.org and find a testing location, schedule an appointment, or if you don't want to do an appointment, you can go to the Tubman Chavez Center, which is an option. But again, contact tracing, you'll see 476 who are out there now, more than 16,000 case investigations performed. I've experienced one of those. And again, I want to commend our contact tracers for what they do every day to help us in the fight of coronavirus. Our next chart, you will see that today we are setting a new record in number of positives, 498. That's beating yesterday's record. Yesterday was the previous record. Prior to that, it was 2 days before that. So again, 498 new positive cases out of the 6,908, which is a 7% positive rate. Again, our rolling 14-day average is 4.1%, and you can see in the purple line there the significant uptick we've seen in percentage of positive cases as we move through. This is very concerning and part of why we're taking today's action. Our next chart, number 3, you will see here is hospital census in San Diego County for COVID patients. You see an increase in both ICU-related COVID patients from 165 to 178, and an increase in total COVID patients from 427 to 458. So again, both of these are increasing, and you can see over the course of the last week the steady increase that we've seen in COVID-related hospitalizations. The next chart will show you the COVID hospitalizations at the bottom and the total hospitalizations. And what you can see here is as we've seen an increase in COVID-related hospitalizations, we've seen non-COVID hospitalizations decrease just a little bit over the preceding days, which puts us just below that 4,000 number of total hospitalizations in our county. And then my last chart is our ICU capacity. And again, what you can see here is the 178 is the COVID-related ICUs, which is an increase from yesterday and an increase going back several weeks for COVID, but a slight decrease in non-COVID ICU utilization. And so we're holding relatively flat, down a little bit yesterday to today in terms of overall ICU capacity and utilization. That concludes my